Good morning, everyone. My name is Renee Stubbins, and it is my pleasure to present our project to you, the impact of virtual reality in biophilic environments on distress and pain in oncology patients. This is our research team, which includes myself, Ashley, who is our oncology infusion nurse liaison, Dr. McNamara from the Department of Visualization, and Dr. Shu from the Department of Epidemiology. And they're both with Texas A&M. Our community partners, we are very fortunate to have them. Peter Caldwell from Senior Designer at Esker Robinson, who connected us with Live Roof, who provided our garden plants. Hank Hancock from Skyline Art Services, who was very instrumental in our art mural design and execution, and Gonzo247, who is the artist of our art mural, and the Trevino Group, who helped us install our rooftop garden. So just some background information on why we decided to do this project. Epidemiological studies have demonstrated exposure to nature can effectively reduce stress and improve mental health outcomes. Our patient population is the oncology patients who are undergoing chemotherapy. We are an infusion center, and being diagnosed with cancer is very scary, and going through chemotherapy is also very scary. And there's several things that are going through a patient's mind when they first come into our infusion center. And the main things that we, really see a lot of are pain, distress, anxiety, and fear. 9 out of 10 patients who are on chemotherapy are on some sort of narcotics to help control their pain, and 50 to 70% state that their pain is uncontrolled and fear pain over death. And oncology patients also have an unmet psychological concern that can be really difficult to assess. Everyone deals with it differently, and everyone has different walls up. So really trying to help navigate on how to address both of these issues, pain and distress, can be very challenging. And we are very proactive in our clinic, and we do a pain scale when they come in, and we do a distress scale when they come in. But we also felt that there was an opportunity here to use nature to help manage both of these chronic conditions in our patients. Our hypothesis was that interactions with nature, either by viewing a garden virtually or in real life, would decrease their pain and distress while receiving chemotherapy. We had 2 objectives. Our first objective was to determine if a biophilic virtual reality or horticultural therapy can decrease an oncology patient's distress and pain while receiving chemotherapy. We also wanted to determine if exposure to a biophilic environment, either virtually or in real life, can impact an individual's choice to be more involved in nature. This was our original research design. It was a case crossover design, which basically means that the patient served at their own control. We had planned for 36 oncology patients who are receiving infusion every 2 weeks for at least 4 cycles. And they would go to each of the rooms, control room, virtual reality room, and a garden view room in random order. At the time that we did our data analysis for this presentation, 27 oncology patients had completed the study. We did do an early amendment in the protocol to include patients who are doing chemotherapy every 2 to 3 weeks, just to increase participation. They were still need to have at least 4 cycles, and they still went to each of the 3 rooms. So again, the control room, the virtual reality room, and the garden view room. The outcomes that we were looking at were pain, distress, blood pressure and heart rate, and saliva cortisol. And we looked at these at the beginning of the infusion, so before chemotherapy, and after the infusion, after chemotherapy. The saliva cortisol was specifically collected between the hours of 8 and 10 in the morning and 12 to 2 p.m. in the afternoon, just to make sure it was consistent across the board. This is what our control room looks like, and as you can see, it's a private room. There is no window, but it does include a TV. This is our virtual reality quote-unquote room that was basically a control room plus this VR headset, which was the Oculus Quest. It included a 10-minute orientation on how to use the headset and to introduce the patient to the NatureTreks app. And this app is very immersive, it's very interactive, and can be kind of take you to different places. So it can take you to an ocean, a green meadow, a sunset, a snowfield, outer space. So there's quite a variety. And so we would show the patients on how to navigate through that space. And they were encouraged to use the VR headset at their leisure. And this is our garden view room before, and this is it currently. So as you can see, it's very impactful. Being in the room, it's very bright. You get the reflection from the mural and the flowers. It's hard to kind of describe it in words, but it's just a very impactful room when you're in there and its presence is among you. This is just kind of a different point of view. So this is before installation. This is at the installation. And this is our garden now. So it really has grown quite a bit in the past year. All right, so I'm going to share our results with you that we have so far with the 27 patients that have completed the study. The average age was much older than we were expecting. So it was around 59, and we had quite a range from 34 being the youngest to 74 being the oldest. Most of our patients were female. And most of our patients would be classified as advanced cancer patients, so either stage 3 or stage 4. And it makes sense that if you look at the cancer type, most of our patients were breast cancer patients since most of them were female. And many of them were in the GI cancer realm, so either pancreatic or colorectal or gastroesophageal junction. These are our biological outcomes I mentioned earlier. So we have our control room, our garden, and our virtual reality rooms. And this is pre and post chemo. And there's some interesting trends here I wanted to point out. So as you can see in the heart rate, in the control room, it went up. But in the garden and the VR room, it actually went down. The other interesting thing we saw is the blood pressure trend. So if you look at the control room, you can see that there's a decrease in the systolic, but the diastolic stays about the same. And the garden view room, the virtual reality room, both of them decreased quite a bit. So there might be something there to further explore. Saliva cortisol, to be honest, looked about the same in most of the groups, but when we put it in the box plot, it does look like it is trending down a little bit more here, as you can see. And on that note, for the virtual reality, we included a table here to kind of show you what the average time used in the VR headset. And it was almost an hour, which, is pretty cool if you think about it, because these are, kind of an older generation to where you don't think Oculus Quest is really targeting that generation. They're more targeted toward the younger generation. So again, these are all just kind of mental notes we're all taking in to really consider for our next research project. The maximum time used was about 150 minutes, and a couple of patients really enjoyed the VR headset so much more that they really wanted to use it after they completed the study so that they could have it during their chemotherapy. We also included a post-study questionnaire, and one of the questions we asked was, since starting our study, are you spending more time outside? And about half of them said yes. And this is pretty cool because these are advanced cancer patients that we're getting to go outside, which is not something you normally associate with advanced cancer patients. So again, meaningful data. We also asked them, since starting our study, are you more interested in the effects of nature on your health? And about 90% of them said yes. So again, taking it all in and really thinking about how we're going to design our next study, because patients are interested in these kind of studies. And I think, that really does need to be considered when we're planning for the future. And I wanted to include just some of their free texts that they shared with us. And it's funny because they were either team garden room or team VR room, but the overall message was very positive. They really enjoyed being a part of this type of study that was more targeted towards their behavior and their lifestyle, which again is really important when we're planning our future studies. Our next steps include using funding from our Garden Club grant and hopefully collaborating with small places, and developing a project that includes adding edible flower boxes or vegetable boxes or fruit boxes up in our garden to have patients participate remotely in the gardening. I'd like to take the last few minutes to thank our HMH leadership. It is not easy putting a garden 21 floors up, and it really does take everyone, specifically capital planning and facilities. Special thanks to Deborah Freer, who was our project manager, who is pictured here, Peter Caldwell, Hank Hancock, and Gonzo247. I'd also like to thank our fellow staff up on the outpatient floor of 21. They really did help us with just data collection and making sure our study, kind of went about smoothly. And, all the little things really do make a difference. And lastly, I wanted to include my contact information for anyone who's interested in collaborating for future studies. I am an open book, and I really appreciate your time today, and thank you for letting me share my project with you.